Good day. This is Dr. Gordon Koltis. I'm a radiation oncologist and fellow of the American College of Radiation Oncology. I've been doing clinical case chart reviews now for almost 15 years. Today, what I'm going to do is show you how to navigate the new software that we're using for reviewing charts, which is called Alexandria. So once you get to the Alexandria link, your link to get you there on the internet, which you can see right up here, ACRO Alexandria Care Authentication Sign In. It'll bring up your login screen. I've already had my login credentials in there, my email address and password. You may be asked to change your password every few months or so, and everybody's familiar with that. So I'm going to go ahead and log in. This goes to the home screen, and currently is showing you a list of locations where charts have been submitted for your review. In the future, we'll find an indication to show that these have already been completed, but right now these are some completed charts that are still showing up and says they're active. But once you select, so this webinar 2025 is the new charts that I'm going to be using for this demonstration. You can open it in two different ways. You can either select the reference name right here, or you can go all the way to the right to where this eyeball is. Once you click on this from the home, as you can see up in the top left, the home screen, we'll click on that eyeball and it goes to accreditation overview. This is now showing all of the cases that have been submitted from that particular center. So if you went back home and you selected cases right here, either by clicking the eyeball or by clicking the reference name. So I'm going to click 46706. And again, it opens up all the cases submitted from that location. So we're going to go back to the webinar. I'm going to open up the cases that I have here that we can use. And I'm going to select the case. And again, you can see the chart number and a reference as to what this case is. Excuse me. So this is a GI. It says low. This is GI esophagus, GI lower. So this is going to be lower GI. And if you come over here, this is for patient charts upload. This is for centers that are uploading data. You don't need to do anything with this. This is to look at DICOM RT images. We'll come back to that. This candy cane happens to be the icon associated with GI charts, and this is a GI chart we're reviewing. If you get into the chart and find out that it's palliative rather than actually a curative intent or full course of radiation therapy, you click on this, which says chart review PAL, which is palliative, because the expectations for what you're going to be scoring and looking for are slightly different. So you can convert it to palliative if it's really not a good case for you to be reviewing for curative intent. Way over on the side here is for discussions, and we are not using that. This candy cane, again, is for GI cases. If it's head and neck, I believe there's an icon of a silhouette of a head, but each of the disease sites have a different icon. So you will see something different depending upon which types of cases, which anatomic site you review. The rest of this, as far as switching to QA review, clear filters, and all this stuff, you can ignore it. So we're going to go ahead and open the case that I'm going to review by selecting the candy cane. And I have already put in some comments. So this opens up the score sheet and also gives you access to the actual records. Now, there's a couple different ways you can get into the records. If you take a look here underneath, under H&P, we're going to look at the consult PDF, and there's also a colorectal note. Underneath here, it gives you the criteria, the bullet points that you are looking for pre-op and post-op cases in the H&P category. And again here, relative physical findings. So this is what you're looking for, and this is what you should be using as a basis of your scoring. So if information that is listed here is not addressed in the records or documents that have been uploaded, then you are free to be deducting points from the total of 5. We'll go back to this. Now, I have not scored this yet, And just as a note for scoring, I normally leave everything blank until I'm sure that I have completed finding all the information I need, and then I'll give it a score. So if I've given it a score, that means that I'm done with that. I don't have to come back and look at it. If you scored as 0, it's scored as 0. I can't undo it right now, but anything that is scored less than 5 absolutely requires that you put a comment in. You have to explain why you took points off. So this was covered pretty well, so I could give this a score of 5. You notice the screen flashes because every few seconds, if you make a change, you will see that the screen will flash. It will save your data. So in case your app crashes, you would lose your data otherwise. But this is new in Alexandria, so it keeps up with it so that you don't lose your data and your comments. So since this is already scored, and again, you can expand this box and take a look at what you put in. To get to the consult note, we're going to click on the word where it says consult. Now, once you click on consult PDF, you will see there's 2 ways to get to the consult. You can click this upward right pointing arrow, and that's going to open it up actually in a separate screen. If you do that, you can pull that off. I have a dual monitor, so I can pull it off and pull to another screen if I want to separate looking at the information, which this has been redacted for patient information, redacted for this training, and then read your consult note. You read it like you read any other consult note, obviously. Then if you're not doing this on a separate screen, I'm going to just close this. So this is going to close this separate window. So another way to get into the consult note is to click right here where it says consult PDF. And now this opens it in the same screen in front. Now you cannot resize this window right here, but you can use some of these other tools. Clicking on this gives you a sidebar, which shows you the pages of the note here. I normally do not use that. So if I click this again, it'll get rid of that. It gives me full screen. You can put in a number if you want to see page 1 of 5, 4 of 5. We'll go back to 1 of 5. Or you can use this arrow to toggle through the pages 2, 3, 4, 5. Now, if you're at the end or near the end and you want to go back, you can come over to the double arrow here. And if you click that, it'll go to the first page, last page. If something is scanned in sideways, you can rotate it and rotate it back. You can enable a hand tool to move the document. And you can disable the hand tool if you don't want it to be in the way. I use this once I'm at the end of 5 or 6 or 7 pages just to go back to the first page. When you're done reading the information, then you can close the viewer. Again, I like opening the document here so it opens in a separate window and pull that window to the side because then I can see the consult note, read the PDF, and enter my comments at the same time. I put in comments right from the very beginning. The first thing I do when I go to a chart is to populate it. I put in the case so that in case I have to leave doing this review and come back to it, I know that this is a case I'm looking at, the stage, and these are references that I'll use to come back to that help me with subsequent categories that I'm going to be using. We'll come back down here, for example, to appropriate staging. And again, what are you looking for in staging? You're looking for, in this case, transrectal ultrasounds, CTs, MRIs, CAA, liver function tests, PET CT scans. These are the things that you want to look for. Some of them are necessary. Some of them would be optional. Obviously, if you do a PET CT, you may need to be doing an MRI. Labs should also be submitted as official reports. Now, if you look here, I commented so that I can keep track of what's going on when I go to score it. A CT of the chest in the consult note said it was done on February 6th. Well, yes, they did provide that report. Here, a CT of the abdomen was supposed to have been done on this patient on 1/3/23, but they did not submit the report. So you must have official reports on labs and x-rays, CTs, PETs, and things of that sort, imaging studies, because you do not know for sure that something was done or if it was done on that patient. I not uncommonly will find that there's a comment that this or that is supposed to be done or was done. We can only score based on the official documents and that not on a commentary that could be in error in a clinical note. So again, report was provided on these endoscopies, colonoscopy. This is a GI rectal cancer patient. There was no report of the colonoscopy. So obviously there's some missing information there that we would need. I'm going to score this as something missing. This is just for an example. I suggest when you first come to the cases and you're looking at the case and you open up this consult, once you read the consult, which is going to say we plan to do this and this and this and that, I normally then will go down to the completion summary, the treatment summary. I open the treatment summary so I can read it and determine whether in fact what they said they were going to do actually happened. The patient may have stopped treatment early, they may have switched to palliative. So when you come down to this, you really realize that this patient received 50/40 centigrade in this manner. And that helps you know before you get to the end of it that you are reviewing a potentially curative case and it did switch or something changed on you. There's another way that you can look at that by going to a tabs view right here. If you can see in the upper right, when you do that, it opens up these tabs. So that makes it easier for you to be able to go to simulation, treatment planning, summary. You can go to the various general categories to look at. I tend not to use tab review, but you can do it if it makes it easier for you. So I'm going to get back out of it. So again, typing in this information, I find it useful to be able to put comments in. There are some situations where, okay, I might just say, was there an appropriate treatment plan note? I might just say, okay, because there's nothing wrong with it. I still type in okay. That means, and there you see the screen flash, so it saved it, so you won't lose your information. So when you come through to the very end, after you select the score and make sure that you're seeing things, typically I'm not seeing contouring. Well, we have solved the problem with the new software about contouring images not being submitted, because we can actually now look at DICOM viewing images. I'll go back to that in just a short time. When it comes to treatment and treatment verifications, endosimetry, weekly OTVs, I tend to come down here and look at the completion note and put in the treatment dates so that I know that this is what I should see for OTVs, this is what I should see for a daily treatment log, and for physics and the such, so that they're covering the right amount of time. So I find that helpful for me to go back and evaluate things. Chart rounds, weekly chart rounds are what we are looking for. You may see only a single chart round. That's not what we're looking for. Peer review can be done at a chart round if they document that there are 2 MDs who are present. Typically there's 2 radiation oncologists. If they say the case was presented at a tumor board, we do take that for confidentiality purposes without having to disclose that kind of information. If they say it was presented at a tumor board, that constitutes peer review, or more than one rad-onc at a case conference or chart rounds is sufficient. Weekly chart rounds are what's required. Otherwise, you need to take off some points. I normally give them 2 points for peer review and 3 points for looking at the chart and documenting chart rounds every week. Again, what you're looking for in the documents that have been uploaded, and this is all about documentation, medical records is all about documentation. Follow-up plan, if they say they're going to see the patient in 4 weeks, you're fine. Overall appropriateness of care is something that is a bit of a subjective item. If you think that there are some questionable things that have gone on, then you scored anything less than 5. This is going to kick it out for the disease site manager, the disease site team leader, I should say, the team leader, to take a look at that case. So use that if you think there's something fishy. Somebody might end up getting over an 80 for a score, which would get them a passing score on this chart, but there might be something a little quirky about it you want looked at. This is where you make that happen, is by selecting this area and then comment for this, and it will kick it out for the disease site team leader to say. Also, general comments. I make it a point when I get to general comments, and remember, it can get frustrating when you're reviewing charts and things are simply not making sense. Stuff is not being submitted. Data is not there. Remember, we're here to try and help these facilities do a better job. They may have done a great job treating the patient, but the documentation needs to be in the medical records. Don't make disparaging comments. Please make comments that are going to be helpful and productive so that we can help them do better, even if they have not done so well on it. What we want to support. So make recommendations. So regarding recommendations, and I always recommend that they carefully pay attention to the ACRO accreditation manual to ensure that they are submitting all the information that they should and know what's expected of them. They have access to seeing these score sheets, so they know what we're looking for when it comes to a peer review. They know what we're looking for when it comes to treatment, when it comes to putting support films, imaging, and things of that sort. It's all spelled out for them, so you should expect it. So remind them to pay attention to our accreditation manual. That is their guide. And make what other general comments you have and recommendations, but be supportive, be productive. Don't be disparaging about it. So if you want to go back to your list, I should also mention, when you're done scoring everything, you want to make sure you submit the chart for review. If you try to submit the chart for review, it says submit the review or cancel to continue editing. You would normally not be able to submit for review if you haven't scored everything. Right now I'm going to cancel it. We'll come back to it. But if you have not given a score to every category, it should not accept your submission for review. We'll test that out in just a second. In the meantime, to go back to your list, we're going to go back here to the green tab. That backs us up. And we're going to then go to DICOM RT data. When you open that up, you go to the eyeball over here, and this opens up your DICOM page. All of this stuff is inaccessible. You see that you can't do anything with this. Again, you come over here to the blue Open DICOM Viewer window or icon. You click on that, and now you can take a look at contouring. You can take a look at the DVHs. You can turn off the GTV. If you're doing this post-surgical excision, for example, or resection. But you can view what the PTV is supposed to be looking like. And you can look at your organs at risk, bladder, rectum, femoral heads in this case, so that you can see how well this data has, how well the dosimetry has worked for what your what your constraints are supposed to be. And all of this is available. You can scroll through the images on the right here where you see I've clicked onto the axial section, and you see I'm going to turn off the isodose lines so I can actually look at the contouring, so I can see the femoral heads are contoured. So you can get rid of the areas that you don't want to see and be able to see that the femoral heads, that the rectum is contoured, the bladder is contoured, and you should be able to remove those. We're actually getting a bunch of isodose or a bunch of cloud views here that should be able to be turned off as well. Let me look right here. So we're going to turn off the 30% line, the 50, the 70. We don't want to see this stuff, especially if you're looking at contouring only. Now you can come down and take a look at the rectum. Scroll through to it, and there you see the rectum's contoured. Here are the femoral heads. So remember to use these things, targets, open and close these lists, so you can turn on and off so that you can see the items that you want to see. To get out of DICOM viewing, then you figure, so you go back, you can go back to your chart review again and open this up, turn on your tabs, and you can come down to where you're looking at various things in treatment planning, including contouring, dose constraints, now that you've looked at your DICOM imaging, and you can update your scoring. By and large, that takes care of pretty much the entire scenario for going through the charts. I am going to go back down to the end of my score sheet, and I'm going to try and submit this. I'm going to try and submit it now. Now the form has been saved. This actually should be blocked from being saved unless everything is scored, so that will have to be addressed in the future as well. If you have a problem with it and you accidentally lock the form and you're not done scoring everything, that will be blocked in the future. Call Valerie Guth and she can unlock it for you so you can edit things if there really is a significant mistake that you made. That being said, I think that covers the entire process. Thank you very much for listening. Again, this is Dr. Gordon Koltis, and good luck and thank you for participating in our accreditation process.